Myself, Dr. Prasanna Keshava, Professor and HOD from Department of Kaumarabhritya, Yenepoya Ayurveda Medical College. Today we are going to discuss a little bit on the awareness on Shayyamutra, which colloquially called as the bedwetting. Okay. At the end of this session, you will be able to know what do you mean by this Shayyamutra or Nocturnal Enuresis, or otherwise called as the bedwetting, and how it is linked with the developmental milestone in few of the cases, and we will understand the likely management of the same. Most commonly, people will bring their child to the OPD with the complaints of night time the child voids urine in the bed. So, there are two types of these types of issues wherein the child voids the urine during daytime, which we call as the diurnal, and the child wets the bed during night time, which we call as the nocturnal enuresis, and which colloquially is known as the bedwetting, and in Ayurveda we call it as the Shayyamutra. So, it actually refers to a case wherein the persistent wetting beyond an age at which we expect the child to have a normal control. So, which is said to be in and above 4 or 5 years plus. Okay. So, above that age, if the child wets the bed, then we can call it as the Shayyamutra. So, it is very much common in case of boys, wherein around if you look into the ratio of female to males. So, in males we will find 60% of the cases, and especially we will find a positive family history as well, which in terms we can say that if you look into their paternal side, somebody in the paternal side maybe had the similar history, or from the maternal side as well, or even among the siblings. So, to define this nocturnal enuresis is that repeated voiding of urine into clothes or bed at least twice a week for at least 3 consecutive months in a child who is at least 5 years of age. So, he should be above 5 years of age, because that is the time wherein the child who is just born just knows only to cry and to sleep and to feed himself. So, from there if you look into the child's development or growth, we can see that the child was completely needs somebody's support. So, by the end of 5 years he will be going to school, right, maybe preschool or regular schooling. Okay. So, there is a lot of changes in the child system in terms of his weight will be gained, his height will be increased, and so many milestones he will have passed. In medical terminology we call it the milestones, we group under mainly 4 headings. So, to tell a few, say for example the child first milestones to achieve in case of gross motor milestone will be the neck holding by the end of 2 or 3 months, and then the child will be able to sit by 6 months and stand up and will be around and to walk as well by the end of 1 year. Okay. So, and by the end of the 1 year, if a stranger child you are seeing and you are waving a bye bye, the child will be waving bye bye back to you. Okay. So, he identifies the mother, so which are coming under social milestones. So, same way if you give a pen and pencil or paper, okay, and to give him to write, then he will start scribbling. So, he will start speaking dada, mama, which are bisyllables, and then he will learn to tell about this few of the words and then few sentences. So, all these are the milestones which we can see. So, and after 4 years only he will be able to attain his bowel as well as the bladder control. Okay. So, in Indian scenario we usually find this bowel and bladder control a little bit earlier compared to the western countries, but it is actually a process wherein the neuronal maturation has to happen. So, to look into the physiology of bladder control, he should have several conditions to be met. So, first of all he should have a awareness of his bladder filling, and then the bladder should not constrict. Okay. So, that for that the stimulus will come from the brain, which are the parts of the cortical inhibition from the brain of reflex bladder contractions, and then he should have the ability to consciously tighten the external sphincter to prevent the incontinence, and the normal bladder growth should be there, and motivation of the child to have a dry night especially. Okay. And girls usually acquire a bladder control before boys, and always the bowel control typically happens before the control of bladder. Okay. So, that is how the physiological process goes. And if you look into this classification of this enuresis, there are mainly two types which are based on the age. Okay. So, the child who has not at all attained any bladder control. So, say for example, at 2 years, 3 years he is wetting his bed. So, the parents may be putting the pampers, and they continue to use it even beyond the age of 5 years, 6 years, 7 years, 8 years. Okay. So, that is called as the primary enuresis, and if you, the second variety we call it as the secondary enuresis, in which the baby or the child was dry for few months, at least 6 months, and then started wetting again. So, the child's age may be like 8 years. So, at 5 years or 4 years he has attained a good control, and later on there was a typical dry period, and then he started wetting again as per the definition. So, then we call it as the secondary enuresis. And the second variety is based on the time of the day. So, whether he is passing the urine without control during day, that we call as the diurnal, and only in night, that we call as the nocturnal, and in both also can be found in 15% of the cases. So, most often it is 80%, it is a nocturnal only. So, that is why the terminology nocturnal enuresis has come. Okay. So, if you look into the etiology, so the parents will come and ask, so what is the issue with this child? So, why he is wetting his bed? Okay. So, in that case, if you look into the causative factors, we will look into the entire picture, okay, of his development, of his anatomy. So, all those we need to rule out. So, there could be some of the anatomical structural issues probably may be there, or genetic issues. Okay. The child may be suffering from some genetic anomalies or developmental issues, wherein the previously I had mentioned about the 4 types of different milestones. So, the child has had a single developmental issue, or all the 4 developmental milestones the child has not attained, groups of milestones which we call as the global developmental delay. So, to tell one example, like a quadriplegic cerebral palsy child. So, at the age of 10 years also he would have not attained the bladder control or even bowel control as well. Then the child may have a sleep related issues, okay, wherein sleepwalking may be there, or psychological issues, or we call as the behavioral issues, especially because of many reasons, and infections of the bladder or worm infestations. Then endocrine hormone related issues, say for example the diabetes mellitus, okay, or diabetes insipidus. Then if we call it from the Ayurvedic side, we have got something called as the Vata dosha aggravation. So, to give an example, the child may be suffering from a chronic constipation. So, in all these cases there are possibilities of the child suffering from this bedwetting. So, what we do is that we try to identify the cause, and in some cases few investigations also is being advised, and based on that the remedial measures are being put. So, but even on there could be a spontaneous remissions also, and steady progression of the symptoms may also is seen in some of the cases. But most often if there are no major anatomical issues, or we can say the genetic or these developmental issues are not there, then in most of the cases we will find good improvement or management is very much possible. So, for that we need to identify the stress factors, and in most of the cases like secondary enuresis, wherein the child has started wetting again after a period of dry nights. Okay. So, in such cases counseling and rewards for the dry nights are very much useful. So, for this we can use the alarm method, wherein say the child is made to urinate after sleeping. Within 2 hours the mother will wake him up, and then again after 2 hours the child is again wake him up, and the child is made to urinate. So that the timing where the bladder control also will be achieved, and the cortical or his what you can say, the stimulus from the brain and the awareness, so everything gets developed. So withholding of the fluids at night and voiding of urine before going to bed is also found to be useful. So apart from this, most often what happens is that sometimes the faulty training, okay, so that also plays a role. So in that we need to identify, and the proper way of toilet training is also very crucial, and proper techniques of bladder training and bladder stretching exercises are very important. And if the complaints are secondary to these worm infestations, so in that case Krimihara Chikitsa can be adopted. If constipation is the case, then the medicines which are helpful for free bowel movements are useful, and the child should be encouraged to have a daily bowel movements. So Vatanulomana and Brahmana type of medicines are being given by the doctors, so that also are helpful in maturation of bodily organs. And in most often there will be some psychological issues at play. So in such cases we are giving, which we call as the Manovaha Srotas at play, drugs which are which are acting on that area are also found to be very useful. So thereby the entire issue of a secondary enuresis could be very well managed with all these conditions or medicaments, we can say. Okay. So to conclude, the Shayyamutra is very much manageable, and till now we have discussed the basic causes and its features and the possible treatments. So thank you.